Hi, my name is Banu Madhu. I'm a sophomore at USF and am majoring in biomedical sciences. During my spring 2020 semester, I was able to partner and work with the USF Taneja College of Pharmacy and produce a publication on which today's poster presentation will be on. This publication was written under the guidance of Dr. Yashwant Pathak and in conjunction with my primary author, Michael No. However, the poster was developed by me. Nanotechnology is used to treat and identify atherosclerosis. Atherosclerosis is a common heart disease that impacts many people around the globe, and specifically a lot of people in the United States. It is characterized by the deposit of fatty plaque on the walls and arteries, especially the ones near the heart. Traditional treatments and methods include invasive surgery, medication, and lifestyle changes. However, two out of the three have proven complications. You could probably guess which of the two those are. Nanotechnology, however, has had far better efficacy and efficiency in clinical settings. By definition, medical nanotechnology refers to any material that is smaller than 100 nanometers. To put this into perspective, one red blood cell alone averages around 7,000 nanometers across. The two specific nanotechnologies that we will look into today are liposomes and carbon nanotubes. Liposomes are a sphere-shaped vesicle and are shown over here. And they contain a little hollow cavity right here in which scientists have been able to put drugs or therapeutics. And so um, liposomes are sphere-shaped vesicles and they have either one or two phospholipid bilayers. This gives the molecule the ability to travel all around the bloodstream and go into many different tissues. And so this has definitely been able to go into the human body's heart. And so processes like pegylation can be used to vastly increase target accuracy of the liposome drug combinations. Usually the drugs that are used are common drugs that are just normally used for treating atherosclerosis. However, when they're placed inside the liposome, they can definitely be specifically targeted to areas in which, like near the heart, where it will not be impacting the rest of the body. In which like normal IV uh, will definitely go and like deliver drugs to areas which we do not want them to. Um, Antibody attachments can also be used instead of pegylation polyethylene glycol, meaning that the body's own targeting systems and immune systems can be used for drug delivery and treatment. Liposomes can also transport stem cells to repair atherosclerosis damaged tissue. And so next I want to discuss carbon nanotubes. And so carbon nanotubes are very thin tubes that are made of one molecule of carbon, and they are shown in this image over here. And so carbon nanotubes have been used in aircraft parts since the 1960s. However, until very recently, they haven't been used in medical applications. And so most commonly, carbon nanotubes are used in prosthetics, medical prosthetics, and specifically it's like carbon fiber applications. And so they're very durable and they're very easy to grow. They can be worked with in order to create scaffolding, which is very neat. However, this is not the focus of our project. The scaffolding can be used to grow tissue and bone, which, however, it can be used to heal and help regenerate tissue that has been damaged by atherosclerosis. Nanotubes can be created by rolling up sheets of graphene. These sheets, once they become tubes, they can be used inside the body to directly send drugs without the use of the bloodstream. These tubes have also been researched into stimulating macrophages, which the macrophages have, in conjunction, like directly attacked the plaque deposits. The tubes however, have a lot of drawbacks, and that's the downside. Um, there are fatal side effects of using carbon nanotubes. If you directly use them inside the body and you target the wrong area on accident, it can cause death. It can also have potential cardiotoxicity to certain individuals. And carbon nanotubes, however, can also have DNA damage, or they can cause DNA damage, which will directly lead to cancer. In conclusion, this project was directly analyzing, it was a literary search, analyzing the usage of nanotechnology like liposomes and carbon nanotubes in order to treat atherosclerosis, which is a very, very common heart disease. They have both had very good clinical trials and clinical efficiency like data. However, they do both have their own downsides, which is still being researched as of now. Um, from drug delivery all the way to immune response boosting, nanotechnology has given medical professionals and patients a new hope for the future. And definitely in the next 20, 30 years, it will definitely be the forefront of medical technology. Thank you so much for your time. I hope you enjoyed listening to my presentation. If you have any questions or concerns, please feel free to reach out to me. My email is located on the top right over here, and I will definitely respond to you. Thank you so much. Have a good day.